Hey everybody, Dr. Demito here. And as you begin your introduction to practicum, we need to speak about anticipatory guidelines. Now, what are anticipatory guidelines? Now, we think about this in terms of the anticipation of things that will need to be done, okay? Or we will the anticipation of the progression of um, mechanics and skills in per let's say for example a toddler, and in adults it encompasses when you're going to need immunizations, at what time you're going to need your pap smears, things like that. It's the anticipation of the provision of care. And it's very important for us as nurse practitioners to understand the concept of this. So, our significance to clinical practice is the primary, secondary, and tertiary prevention activities or health promotion. Back in the olden days, in the late 70s, when nurse practitioners first began to work in the medical field, we were more often public health nurses. And our duty at that time was to promote um, primary, secondary, and tertiary prevention in hopes of preventing disease. And what these topics consider is promoting health, early disease detection, the treatment of established diseases, and these are all crucial parts of the NP role. There have been several instances throughout my career where I have detected things that a primary care provider did not. And I see it in my own health. Uh, Sometimes primary care providers are not as diligent as they should be. And there are many factors. I'm not saying that they're, not good providers. They certainly are, but there are many factors. And primary, secondary, and tertiary prevention is often discussed on your certification examination. So that's another really big reason why you want to know, feel comfortable with these terms and what they mean, because on the certification exam, they may pose a question where they ask you, immunizations are an example of, and then you need to identify whether it's primary, secondary, or tertiary prevention. Okay, let's go. So anticipatory guidelines are now part of our SOAP note. So we're going to expect that you will include anticipatory guidelines in the SOAP notes that you provide to us. And you can see that you will include at least 3 primary prevention strategies, and that's going to be related to age and conditions. And this can be immunizations, pediatric prenatal milestones, anticipatory guidance, and at least 2 secondary prevention strategies. And that would be like screenings for pap smears and things like that. SOAP notes are going to be pass-fail, but I want you to anticipate that you're going to get a lot of comments from me. And with SOAP notes, I'm going to be very strict because the development of a proper SOAP note is of the utmost importance. Because as you are developing that SOAP note, it's part of the diagnostic process. So the patient may come in with a specific complaint, but by the time you delve and dig and get the information you need, you find that the patient is there for something totally different. For example, I have had patients come in with a complaint of burning with urination. They think they have a urinary tract infection. Well, after I am talking to them and delving and getting my information, ultimately I find out they're worried that they may have a sexually transmitted infection. So The development of that SOAP note is of the utmost importance, and that's one of the reasons you're going to be getting a ton of comments from me. Now, if I make certain comments where you haven't gone deep enough or you need to expand, you will need to correct that SOAP note and resubmit it. You will not get credit unless you do so. So make sure that you pay attention and you look at the comments that I've made on those SOAP notes. When you're a student, more is better. Now, I know in my clinical practice, I document very little. To be honest with you, I do the chief complaint, the HPI, of course, I do the physical assessment, I do that, but minimums, okay? I do focused exams. If the patient is in there for a throat complaint, I'm not going to be looking at her legs, okay? So it's, but that's because I am an established provider that has been practicing medicine for since 2005. So you'll get there, you'll have your opportunity to do that. But when you're in school, more is better. And I remember, it's not going to be easy. I well remember writing my SOAP notes when I was in nursing school. I must have PTSD because it's very clear in my mind. I would sit there Sunday and I would spend hours writing one SOAP note. How crazy, right? But it's necessary. So let's move on. Remember, anticipatory guidelines, they have nothing to do with the chief complaint. They are based on the patient's age, gender, pregnancy status, smoking, sexual history, and it's an important concept to understand that the anticipatory guidance really has little to do with the visit itself unless they're there for a well exam, okay? And I will talk to patients, that come in, like I do in my practice. It's mainly acute care. So they come in because they've got a complaint, they're sick, they have something wrong. And but I will look on the chart and I'll say, oh, you know what? You should really consider getting a shingle shot because you're over 50 and you didn't get one. And shingles is not something that people want to get. So I will introduce that in, even if, the patient is there for something totally different. Primary prevention measures are those provided to individuals to prevent the onset of targeted conditions. Since successful primary prevention helps avoid the suffering, cost, and burden associated with disease, it's typically considered the most cost-effective form of healthcare. So let's look at some examples. Immunizations, education and counseling, promoting the use of automobile passenger restraints, bicycle helmets. I also want to add in here firearm safety because that's something that we need to consider as well. So there are lots. If you are questioning it, do a Google search, primary prevention strategies examples, and bam, you'll get a zillion of them. Here is a typical vaccination schedule for adults. Mind that sometimes these change. For example, there was a time where HPV was only offered up to the age of 26. Now it's offered up to the age of 45. The shingles vaccine used to be only offered for those over 65. Now it's offered for patients at the age of 50. So vaccination schedules will change, primarily with adults, I find, and children too. When I think about it, children need to get a Tdap in 5th grade and a senior year in high school. It used to not be like that. A meningitis shot as well. They get a meningitis shot. So they change. You've got to stay up with the current immunization schedules. Secondary prevention measures are those that identify and treat asymptomatic persons who've already developed risk factors or preclinical disease, but in whom the condition is not clinically apparent. So these activities are focused on early case findings of asymptomatic disease. With early case findings, the natural history of disease or the course of illness unfolds over time without treatment. and we want to minimize morbidity and mortality. So here are some examples: screening tests, and those are done on patients without clinical presentation of disease to identify disease with a significant latency period, like hyperlipidemia, hypertension, breast cancer, prostate cancer. So secondary prevention is screening. And here is an adult preventative health care schedule. Again, be mindful that these things do change. And here's another one. So here's a case scenario. Ms. Leonard is a 72-year-old woman with COPD who is a former cigarette smoker with a 60-pack a year history. Her conditions include long-acting beta-2 agonist with inhaled corticosteroids and PRN short-acting beta agonist. Which one of the following interventions addresses a primary prevention need of this patient? Remember, primary. This would be administration of annual immunization of flu. Ms. Giordano is a 68-year-old woman with hypertension who resides alone in a private home. Which one of the following interventions addresses secondary prevention need of this patient? Administration of pneumococcal, mammography, home safety, assessment of abnormalities in the cardiac exam. Remember, secondary prevention is screening. So that would be mammography. Okay. So I would also consider downloading the AHRQ EPSS application. This helps identify preventative services. You can also look at the Preventative Services Task Force. So these are all sites that you may want to have on your computer. You can use those for reference. And this is what it looks like here. So prevention, primary, secondary, and tertiary prevention can help you prepare for that certification, and also in clinical practice it's important to guide care. So remember, we will expect this to be part of your SOAP notes. Thank you so much, and I hope that you find this helpful.